I will start the presentation with the introduction. So, what is sport injury? Sport injury means any injury, whether physical or psychological, incurred as a result of participation in organized or recreational physical activity like ACL, ankle sprain, or runner's knee. Next is healing process. The stage of wound healing proceeds in an organized way, and there are four processes. First one is clotting, second one is inflammatory, the third one is proliferation, and the last one is maturation and remodeling. Next, we move on to the meaning of hard tissue. So, what is hard tissue? Hard tissue is tissue that are highly mineralized and very hard, as we can see on the slide. The example of hard tissue are bone and cartilage. That's all from me. I will pass to the next presenter.
Hi, I'm Liu. I will be presenting about the effects of injury to the bone. We have four types of effects here, and the first one will be malunion, which means that the bone heals in the wrong position. This means that when a fracture happened and during the recovery process, the bone healed in a wrong position, or it may shift during the healing process. So, malalignment of the bone causes low strength, pain, and higher risk of refracture at the site. Second, we have non-union, which means bone that does not heal back together. Briefly means that the bones are not connected or fail to heal. This non-union usually happens due to poor in calcification, which is a process of producing calcium. Patients with this effect usually feel pain at the injured site. Thirdly, pain on activities. When the bone is fractured, even though it is healed, but some of them still feel pain at the site when they are doing daily activities such as walking, jumping, running, or squatting. This will cause them to reduce the amount of exercise and eventually causes the integrity of muscle breakdown. Lastly, difference in bone length. When an injury happened to the bone and it healed, but there might be problems like bones heal but in different length. So this causes them to feel pain and difficult to move.
I'm going to explain about effect on injury on cartilage. People with injuries on cartilage are higher risk of osteoarthritis or OA. OA is a degenerative joint disease, which means tissues in the joint break down over time due to the joint's overuse. When joints are overused, it can lead to joint locking. Joint locking happens when the membrane around the joint, known as synovial sheath, become inflamed. People will have difficulty in bending or straightening the joint. Next, people with injury on cartilage will affect their daily activities. They tend to feel pain while doing any activities. This happens because the cartilage getting thin and the bones end up rubbing together. This will affect their mobility to function normally.
The period of the healing process for bone and cartilage. The healing process from bone is 6 to 12 weeks or more, where cartilage is 3 to 12 months. Next is the stage of the healing process for the bone. This stage is divided into three, namely inflammation, reparative, and remodeling. In the inflammation stage, the body sends signal for special cells to come to the injury area. Some of these cells cause the injury area to become red and painful. For the reparative, it starts about a week after the injury. A type of soft bone replaces the blood clot that formed during the inflammatory stage. Over the course of several weeks, the soft callus become harder. Lastly is the remodeling stage, where it starts around 6 weeks after the injury. In this stage, regularly, bone replaces the hard callus. But over the next few months, the bone is reshaped so that it goes back to looking the did before the injury.
My name is Nur Aina Nazifa binti Syari Asni, and I'm going to talk about the stage of cartilage healing. There are three stages, which is pro-life active phase, transition phase, remodeling, and maturation phase. The first one is the pro-life active phase. Pro-life active phase is an after-cell attachment where a non-specific soft repair tissue is formed. The second one is transition phase, which a specific integration into a local environment and the improvement of the structural quality of the repair cartilage can be observed. Lastly, the remodeling and maturation phase, where the final adaptation of the cartilage is made to the biomechanical needs of the various joint compartments. This process includes a period of time which up to 2 years as seen in MRI studies.
Assalamualaikum and a very good morning to Dr. Azrul. So my name is Nur Zakira binti Muhammad Nizam and I am going to present about factors that impedes bone and cartilage healing process. As we all may know, there is characteristics on this factor to determine the factor that could impact on any healing process, which is intrinsic, extrinsic, and also systemic. So I will go through one by one, which is the first one is intrinsic. So in intrinsic factor that can affect bone and cartilage healing process is that if there is any infection. If there is any infection on your bone or cartilage, it will take longer time to heal because your cells need to actually heal the infection first before it can heal the bone or cartilage itself that is wounded. Next one is we have systemic. So the systemic factor that could impede on bone and cartilage healing process is the first one is nutritional deficits. So how does nutritional deficits could slow down your healing bone and cartilage healing process is, for example, in order to heal efficiently, your bone needs calcium. Okay, so if you didn't take enough calcium, okay, for your nutrition, then your bone will have a very hard time to heal efficiently. The next one we have diabetic disease. How does a diabetic person could affect on their bone or cartilage healing process is that when someone with diabetes, their body produce enzyme and hormones that make their immune system less effective, so it may cause more infection. Okay, and also that due to the high glucose in their body, so it can become the source of any bad bacteria to actually use the glucose as their food. Okay, so it will make your bone and cartilage healing process a lot harder. Okay, so the next one is aging process. So aging process is that when someone is older, so their cells and also their hormones tend to act a little slower due to aging. So the last one is we have the extrinsic factor. So the extrinsic factor that could impede on bone and cartilage healing process is smoking habit. As we all know, when we smoke, the carbon monoxide intake in our body, they actually replace your oxygen. So your blood will be thicker, and it also will cause that your blood to to flow slower in your body. That's all for me.
One of the common treatments for bone and cartilage injury are arthroplasty. Arthroplasty is a surgical procedure where the surgeon will replace the fractured bones or the torn cartilage with prostheses. Prostheses can be either metal, ceramic, or heavy-duty plastic. The second treatment is immobilization. Immobilization are used if the injury is mild or non-displaced fracture. The immobilization can be either brace, splint, plaster of Paris. The third one is close reduction. Close reduction is used if the fracture is severe but it is non-displaced. The surgeon will push and pull to align your bones inside your body. On this slide, you can see the examples of immobilization used and also the type of arthroplasty. The fourth treatment is internal fixator and external fixator. Internal fixator, the surgeon will put pieces of metal inside your body to connect your bone while it heals. Internal fixator can consist of rods, plates and screws, pins and wires. The fifth treatment is bone grafting. Bone grafting is done when the bone is severely fractured and isn't healing properly. So the surgeon will then add an additional bone tissue to rejoin the fractured bones. Next is physiotherapy. In physiotherapy, we will assess the patient's condition first using outcome measures, and based on the outcome measures, we will decide what treatment is best for the patient. Either we can use traction, strengthening exercise, stretching exercise. We will teach ambulation, gait, balance training, proprioception, and coordination also.
So as a conclusion, sleep is another important aspect of rest and recovery when it comes to sports performance. The rest and recovery is also important aspect of an exercise program because it allows the body to repair and strengthen itself in between workouts. So we need to have enough sleep to have a better performance than before. That's all from us. Thank you.